Jamaica today confirmed its first imported case of coronavirus disease COVID-19 here in Kingston. The patient is a Jamaican female who had traveled from the United Kingdom, which, as you know, has cases of COVID-19.
So our main interest and big focus at this point is going to be enabling resources to do the contact tracing. So we would be looking at the transportation that brought the person in, the home situation. We will be tracking where and where this person has been, what kind of events they have attended to, and that will give us an assessment of what kind of risk. Is the risk confined to one home? Is the risk confined to a community? Is it confined to several communities? And we would have to put in measures based on that. Once we have gotten the immediate contacts of those persons, we will be looking at quarantine for those persons. Depending on how many persons are involved in terms of our investigations, then we'll be looking to self-quarantine. And of course, at this time, we would want all our primary care facilities, public and private, to be on alert, because they must get a travel history, contact history from persons that are coming in with any kind of influenza-like illness or flu-like illness, any cough, respiratory symptoms. So I think that is where our aim has to be, for everybody to be sensitized to what is happening. We have a more increased level of awareness, so that they can report to the public health authorities, that we can do the necessary investigations and containment as necessary.
Schools by now should have been advised that the government is taking a position to not participate in the pen relays this year because that travel and the location could involve levels of risk that we would like to discourage. And so we are, well, I'm saying it now publicly, but we were going to actually put an advisory out against that travel. As it relates to boys and girls camps, there is a meeting scheduled between the organizers, the Minister of Sports and the Minister of Education and myself, and the main sponsor. Grace Kennedy, of course, is the main sponsor, where a decision will be taken. And that decision should be taken within 24 hours. But needless to say, the fact that we now have a case, nevertheless an imported case, it does elevates the concerns as it relates to public health risks. I don't want persons to be intimidated or abused in any way, shape or form because they are unfortunate to have had the virus. However, they would have picked it up. And not to mention other persons who are not affected, but who are from a similar home or family environment. And I think it's very important that I ask the public to exercise some care as it relates to this. We're all in this thing together, and no matter how much we try, we're not going to eliminate, through aggression or otherwise, the existence or the threat that is represented here with this virus. It really is through a coordinated effort.